Good afternoon and welcome to today's Downing Street coronavirus briefing. I'm joined by Professor Jonathan Van Tam, the Deputy Chief Medical Officer, and by Dr. Susan Hopkins, the Chief Medical Advisor to NHS Test and Trace. And before we talk about testing and vaccines, I'd like to update you on the latest coronavirus data. The average number of new cases each day is now 25,329, up from 22,443 last week. There are today 14,915 COVID patients in hospital across the UK, compared to 13,025 a week ago. And sadly, yesterday, 168 deaths were reported. This means that in the last week, we've seen an average of 413 deaths, up from 332 a day a week ago. My profound sympathies are with everyone who has lost a loved one throughout this pandemic. And these numbers make painfully clear that this virus remains a potent threat. And that threat is not just to the oldest and the most vulnerable, but to anyone of any age and of any background, and we've already seen the serious impact that long COVID can have on people's quality of life, even the fit and the young. Symptoms like fatigue and breathlessness, muscle pain and neurological problems, long after they first had the virus. And we know that long COVID affects thousands of people, many thousands of people. And we've already opened long COVID clinics in many parts of the country, and I am very pleased to be able to confirm that the NHS will have a network of 40 long COVID clinics right across England in place by the end of the month. They will bring together doctors, nurses, the therapists, and the other NHS staff, like physios, to help those who are suffering with the long-term effects of coronavirus. Long COVID shows that this virus can strike us all, and we must all do our bit to strike back by following the rules and denying the virus the connections that it needs to spread. I know that this hasn't been easy, and it's meant celebrating Diwali or commemorating the fallen in ways that have been different this year to what we might normally do. And I want to say thank you to everyone for their patience. We must persevere and get this virus under control. Coronavirus is not a short-term problem that can easily be fixed. We must focus on the long-term solutions, underpinned by the best possible science that can see us through this crisis and also lay firm foundations for the future. This, of course, includes our ability to test at scale. We're constantly improving our response to bring the confidence that high-quality testing can provide. We've already built the largest coronavirus testing capacity in Europe, up from 2,000 tests a day in March to our current capacity of more than 500,000. But we will not rest, because testing capacity helps keep people safe and can help us get things back more like normal life. Today, I'm delighted that we can announce 2 new mega labs, which will open early in the new year. They will add another 600,000 capacity to our daily capacity. That doubles the current capacity. They'll also create 4,000 jobs, and crucially, they'll represent a permanent part of the UK's new diagnostics industry. We didn't enter this crisis with a major diagnostics industry, and so together we have built one, both to help beat the virus, of course, by testing more people and returning results more quickly, and to give our country a permanent defence that we might need for any future epidemic, and to improve our care for so many other diseases like heart disease or cancer or the flu. And I am absolutely determined that we must have a massive diagnostics capacity, not just for this pandemic, but long into the future. More capacity also speeds up turnaround times. But speeding up these turnaround times isn't just about the test, it's also about the logistics. So I want to take just one moment to thank the Royal Mail, who from this weekend will empty some of their post boxes 7 days a week to speed up home testing. It's a big team effort, and I'm very grateful to our posties for playing their part in helping to keep people safe. This expansion of testing matters because it helps to protect people, and I just want to touch on some of the reasons why it matters. It means we can test the most vulnerable and those who care for the most vulnerable, and we can test them more frequently. Over the last week, for instance, we've delivered more than 3 million tests to NHS staff to begin their regular bi-weekly testing. And today, I know so many people have been relieved to hear that we've started a pilot for testing visitors in care homes, to use tests to allow people to visit loved ones in care homes in a way that keeps them safe and brings back some of those magical moments of social contact. Our expansion of testing also means we can roll out mass testing further. We're making progress in the citywide testing across Liverpool, and we're now rolling out this localised approach to other areas. 83 local authorities have now signed up to receive regular batches of these new lateral flow tests, which can allow for results in minutes. This is an important step, and it combines the local insight of the brilliant directors of public health right across the country with the strong national infrastructure of NHS Test and Trace, combining to keep our communities safe. I also want to turn to vaccines. While we don't yet have a vaccine, we can now have hope. You may have heard the two promising pieces of news from earlier today. First, Janssen's phase 3 clinical trials are beginning today in 17 sites across the country, including Southampton, Dundee, Cardiff, and Belfast. It's the third vaccine to enter clinical trials here, and should the trials come good, and that is by no means certain, then it can be, and if it can be proved to be safe and effective, we have 30 million doses on order by the middle of next year. Finally, you will no doubt have seen the excellent news that Moderna have today announced results from their preliminary trial data, suggesting that their vaccine has an effectiveness of 94.5%. This is another encouraging step forward. Although I stress that this is preliminary, the safety data is limited, and their production facilities are not yet at scale. Should this latest vaccine be approved, the doses would be available from spring next year. And I can announce that we have today secured an initial agreement for 5 million doses of the Moderna vaccine. This is a similar RNA technology to Pfizer-BioNTech, of which we've already ordered 40 million doses, which, should that be proved to work, can come on stream potentially before the end of this year. Across diagnostics and vaccines, great advances in medical science are coming to the rescue. And while there is much uncertainty, we can see the candle of hope, and we must do all that we can to nurture its flame. But we're not there yet. Until the science can make us safe, we must remain vigilant and keep following the rules that we know can keep this virus under control. I'm now going to hand over to Dr. Hopkins to say more about our work on mass testing.
Thank you. Testing is critically important in fighting the spread of coronavirus because it allows us to find positive cases, trace their contacts, and to break the chains of transmission. From the outset, we have tested people with symptoms in laboratories, and you've heard from the Secretary of State how we are ramping up the laboratory capacity. However, alongside this, we have been working with our academic partners to validate innovative point-of-care tests that will rapidly speed up the process to find people with infectious virus. We have assessed these tests, called lateral flow devices, rigorously with Public Health England and Oxford University, and have moved 4 into field evaluations to date. These are tests for the antigen, not antibody, so they determine whether you're infectious and need to isolate immediately. In Liverpool, we have used one of these tests to offer rapid testing to individuals without symptoms. This test has excellent accuracy, revealing the majority of cases who have infectious virus right now, today, and with very low false positive, less than 5 per 1,000. These tests can be read in 20 to 30 minutes after starting the analysis process, and people all get their result on the same day, and the majority much faster, within 1 to 2 hours. That means people can isolate quickly and ensure they don't pass the infection to others. The beauty of this test is that we find that we can find people who are not symptomatic, meaning we can stop transmissions before they potentially occur. And we are especially grateful to the people of Liverpool and the directors of public health, local government and academic partners who have worked so hard to get thousands of people tested. Over the last 10 days, with military support, we have tested almost 100,000 people in the Liverpool testing sites with the lateral flow devices and found more than 700 people who would otherwise have not been detected. As you have heard, we're looking to replicate this across the country and working with directors of public health who can target the tests for their own population, understanding the populations who are most at need of testing. We're also running evaluations in schools and universities and are planning to test university students prior to going home at Christmas. And you will have heard also that we're now using these tests in healthcare workers and in care homes. And I envisage that this will really help us support people visiting homes safely. A negative test means that you're unlikely to be infectious at that moment in time, but you will still need to follow the rules, hands, face, space, in case you're incubating the virus, and also to avoid other people transmitting the virus to you. I will now show you an animation and talk through how it works. These tests show that you take a sample swab from a nose or throat, and the swab is then mixed in a tube with some buffer solution. This releases and breaks up the virus to allow it to be attested in the test. We then drop a couple of drops onto the lateral flow device that looks a bit like this, and then the solution containing the fragments of virus starts to move along the adsorbent strip. It hits an area which has some labeled antibodies, and these are the antibodies that allow you to detect whether the test is working and whether the test is positive. And so they join together and keep moving along the strip. Once this occurs, those with virus particles bind strongly to the fragments, and then they attach to the test zone. The remainder of those virus-labeled antibodies, as labeled antibodies, keep moving along and keep going along the adsorbent strip to what's called the control zone. And the control zone is very important because that allows us to determine whether the test works or not. After about 5 minutes, a coloured band will appear in the control zone. This shows the test is working, and therefore we can now read whether the virus is present or not. A coloured band at the virus test zone shows the test is positive and the virus is present. It usually takes between 10 and 30 minutes to read the test. And in the case of the test in Liverpool, we wait a full 30 minutes to say the test is negative. Thank you.
Thank you very much indeed. We'll now take some questions from the public, and then we will take questions from the media. So the first is Bethany from Wandsworth.
The current advice on the priority list for vaccines focuses on age. Will those who are shielding but are not over 65 be prioritised to have the vaccine? If not, do you expect all those shielding to continue to shield until they have access to a vaccine? This could be 6 months or longer of waiting.
Thank you, Bethany. This is an incredibly important question, and I understand how important the prioritisation of any vaccine will be. We've been doing an awful lot of work on it, and there is a statutory body, an official body, that advises me as Health Secretary as to what the right clinical priority should be. It's called the Joint Committee on Vaccinations and Immunisations, and it's they who have set out the interim prioritisation based on what we know already of the two leading vaccines, the Pfizer vaccine and the AstraZeneca vaccine, but they will update that when they see the final data. And they make this clinical judgment. And they also talk to Jonathan Van Tam about what that might be. And this clinical judgment does take into account those who are clinically extremely vulnerable to make sure that they get the appropriate vaccination according to their risk level. And maybe, JVT, you could set out in more detail where that's up to on this, and I should stress, this interim guidance from the formal Joint Committee.
Yes, thanks, Secretary of State. The guidance is indeed interim, provisional, and the reason for that is that we do not yet have the data on the vaccines that will be available to us and authorised by the MHRA. And we can't make those final decisions until it is understood if the vaccines are suitable for all groups. I'm hoping so, but that is a decision that has to be made in the future. It is very clear that the clinically extremely vulnerable are on the JCVI priority list, and many of them will already be subsumed within the priority order on the provisional list by virtue of age or by virtue of having chronic underlying conditions, right down to the age of 18. So from that perspective, I do expect there to be coverage of the clinically extremely vulnerable.
Thank you, JVT. The next question is from Divya from Leicester. And Divya asks, will a national lockdown be extended past December the 2nd if cases and deaths continue to rise? And if not, what is the reasoning behind this? Well, thank you. Another excellent and important question. And the answer is that it is too early for us to know what the number of cases will be as we come to the end of the current lockdown. I might ask Susan to add a few more details. But what I'd say is that at the moment, most of the tests that we're getting back and most of the positive cases are from around the time when the lockdown came in. And so we are yet to see in the data, and it's too early to expect to see in the data, the impact of the second lockdown. But we absolutely hope to be able to replace the national lockdown with a tiered system similar to what we had before. But we, of course, are assessing that and assessing how we can make sure that that will be effective. Susan.
So absolutely. The key issue for us is making sure that cases start to fall. And we expect, if the lockdown is working and we're all doing the best we can to have reduced or no social contact with other people, that we will start to see cases decline over the next week. We expect it will be longer to see hospital admissions, another week or so. But I think that as long as we start seeing cases decline, then we can start making a judgment about what are the right decisions that we make and what are the opening up decisions that happen on December the 2nd.
Thanks, Susan. And just to stress, Divya, I know that Leicester has been in lockdown measures for an awfully long time. They are important to keep this under control. But the best thing that everybody can do is to follow the rules and to try to limit the transmission of the virus. And of course, if you are contacted by NHS Test and Trace, it's so important that you do self-isolate, because that will help to control the spread of the virus. The next question is from Fergus Walsh of the BBC. Fergus.
Yeah, a question to Matt Hancock. You say you've ordered 5 million doses of the Moderna vaccine. That's enough to immunise 2.5 million people. Do you regret not being able to buy any more? And first to Professor Van Tam, are you a bit more confident today, even more confident than a week ago, that COVID vaccines will work?
Well, thanks, Fergus. I'm delighted that we've now been able to expand our portfolio of vaccines from 6 to 7. The Moderna vaccine is based on a similar platform to the Pfizer BioNTech vaccine. And of course, we have 40 million of those to be that are on order, should it work. As we constantly stress, neither of these vaccines is approved. We haven't seen the full safety data. We can't be sure. But I pay tribute to the Vaccines Task Force who've done this buying, even concluding the Moderna deal today. I pay tribute to Alok Sharma, who's worked incredibly hard on getting this over the line, including today, and done a great job. So it's really good news that we've got some of the Moderna vaccine. On whether it's on the number, the thing is that the Moderna vaccine doesn't come on stream until the spring, and so I'm just really pleased that we've got those early vaccines that will be available early, and we've already got the orders of those in. JVT.
Yeah, so I'll follow on from the second question first, Fergus, and say that the Vaccines Task Force, we've had to consider a whole range of vaccines. First of all, in terms of modality or mode of action, the type of vaccine, to make sure that we spread our bets over the different types that are coming forwards, because when you start that process, you have no assurance that anything is going to work. Secondly, you have to temper that against the likely quantities available, and then you have to temper that against the likely timings of the availability of those quantities, accepting that all of that is mired in how difficult it will or will not be for individual manufacturers to make these at huge scale over the next months and years. So all of that has to be factored in, and that's why we've ended up committing to 350 million doses across multiple targets. But to your first question, do I feel more encouraged in relation to another messenger RNA vaccine showing that it is making COVID-19 potentially in the future a vaccine preventable disease? Then absolutely so. It's brilliant news, absolutely brilliant. It's the second penalty now. That's also gone into the back of the net. So we're starting to feel in a better position.
Thanks very much, JVT, for cheering us all up. The next question is from Thomas Moore at Sky.
Mr. Hancock, the Moderna vaccine was always one of the front runners. Why wasn't it part of the UK stockpile from the very start? Why join the queue now when you've only managed to secure enough to protect 2.5 million people? Professor Van Tam, does this second penalty, as you describe it, give you confidence that we may actually get a very good result with the Oxford vaccine, which is also due to report imminently?
Thanks. I'll take the first and hand the second to you, JVT, if that's okay. The thing is, Thomas, there isn't a stockpile. This vaccine hasn't yet been manufactured, and here in Europe, the first availability will be in the spring, and that means that obviously it's critical that we've been buying the first vaccines that will be available. And if you take the Pfizer vaccine plus the AstraZeneca agreements, then between them, we have over 100 million doses on order. It is also good, though, to have some of these other vaccines. Hence, we spread the portfolio. So that's why we've taken the approach that we have to make sure that we have a good spread of the vaccines. And as today's news demonstrates, we keep buying. This process isn't over. We keep buying. I just want to correct you, JVT. You said we've got 350 million. We've now got 355 million on order. Over to you for the second question.
Yes. So on your question was specifically about the AstraZeneca Oxford vaccine, and whether any vaccine is going to work is simply unknowable until the data have been looked at, and nobody's looked at the data at this point in time. It is the same for all of the vaccines still in phase 3 that have not read out. Nevertheless, pretty much all of the vaccines around the world that are in development are targeting the coronavirus spike protein, as the Pfizer BioNTech vaccine has done, as the Moderna vaccine has done. This really does begin to show us that the spike protein is a completely plausible and effective target for vaccines to be working against. And, you know, when we started this journey back in February, March, we didn't even know that. So, yes, we are, we're feeling in a happier place than we were. But do we know the data? No, we don't.
We're not there yet. Thanks very much, Thomas. Catherine Jones from Channel 5.
Secretary of State, thank you. You said in response to Divya's question about the end of the England so-called lockdown that it was too early to see in the data whether additional measures would be needed. But the SAGE subgroup, SPI-M, has reported to you that England returning to just 3 tiers on December the 2nd does risk the R value rising again and would undo potentially any decline in numbers that you do begin to see. With hospitals already under intense pressure, this could really put strain on them come mid-December. And so I'm wondering what measures post-December the 2nd you are arguing for within government on behalf of the NHS and all its staff to avoid a winter of really unparalleled difficulty for them.
Well, that's not quite what SAGE says, and it's well worth going and reading their precise advice because it's not about whether there's a tier system, but it's also about what measures are in each tier. But maybe Susan Hopkins would be better placed to set out the scientific advice on this.
So I think we have recognised that the tiering of the country has had a different effect in each area. Tier 3, and especially Tier 3 plus in the north, has had an effect in reducing the numbers of cases in the northwest, and we can see the northwest declining number of cases now. Tier 2 seems to hold in some areas and not so well in others, and so really it depends on how fast transmission's occurring and how well the individuals in the population are taking that advice in. We see very little effect from Tier 1, and I think when we look at what tiers may be there in the future, we will have to think about strengthening them in order to get us through the winter months until the vaccine's available for everyone.
Thanks very much, Catherine. Gordon Rayner from The Telegraph. Gordon.
Thank you, Secretary of State. Can I just ask, the Prime Minister has told us that he is bursting with antibodies, having had coronavirus, and yet he is still having to self-isolate for 14 days. We know the government is considering bringing in a 5-day quarantine period now, if you have a test after 5 days. Is it not time to rethink the whole policy of self-isolating for 14 days? And just secondly, you said earlier today that you can't rule out mandatory vaccinations. I know you're not planning it. Have you had discussions perhaps about people in certain jobs not being able to go to those jobs, such as nursing, if they haven't had a vaccine once one becomes available?
We haven't had any of those such discussions. On the first question, of course, we always keep under review the clinical advice of what, how we can keep this virus under control whilst minimising the impact on people's lives. And, you know, the Prime Minister going into self-isolation is an absolutely clear demonstration that everybody, no matter who you are, needs to follow the rules. If you're asked by NHS Test and Trace to self-isolate, that it is absolutely vital that you do. And the Prime Minister is demonstrating that through his personal leadership in following those rules. So, of course, we keep those things under review, but we're not at a stage to be able to make any changes yet. Sean Linton from The Independent.
Secretary of State, thank you very much. Throughout the pandemic, The Independent has spoken to frontline NHS staff. Many of them report being exhausted. They are broken. Now, with cases rising, they're facing a bleak winter with widespread staff shortages and morale at rock bottom. But over the past 10 years, most have suffered real terms pay cuts. And you were filmed numerous times clapping for carers earlier in the year. Can you commit today to giving NHS staff a meaningful above-inflation pay rise to help boost recruitment and, most of all, to help make patients safer on wards?
Well, thank you, Sean. As you know, we have an independent pay review process, and we've concluded a 3-year agreement with nurses. In fact, we've just concluded a long-term agreement with junior doctors as well. So though you tempt me, I'm not going to prejudge the outcomes of the independent pay review process. Finally, Jamie Kafash from Pulse magazine.
As Secretary of State, during the election, you acknowledged we needed 6,000 new GPs. Since then, the number of full-time equivalent, fully trained GPs has decreased. GPs are doing more consultations than ever and are carrying out the biggest flu vaccine programme ever. So can you reassure patients and GPs that you will reduce their non-urgent workload to free up time for them to carry out the COVID vaccination programme while ensuring patients can continue to access the urgent care they need?
Well, this is an incredibly important question, and I'm going to ask JVT to comment as part of the vaccines rollout and with his clinical background. But what I'd say to every GP is how grateful I am for the work that you're doing and your whole practice, everybody in primary care, both on the flu vaccine right now, which is being rolled out in record numbers, and we've had a record uptake. We've had a 10 percentage point increase on the normal uptake of flu vaccines, and that's really good news. And of course, on the normal pressures of primary care. I'm really glad that a much bigger proportion of appointments in primary care are now done either over the phone or by video, because that makes life easier for GPs and for patients, and there's been a really positive response to that. But that doesn't, of course, lift the whole burden, even though it makes access easier. And of course, we've got hopefully a COVID vaccination programme ready to go. And I've asked the NHS to be ready to roll that out from the 1st of December. That's the first possible date it could be ready. That isn't my central expectation at all, but we do need to be ready for them because that is theoretically the earliest this could possibly be. The bulk of the rollout is likely to be in the new year if a vaccine, one of the 2 early vaccines, comes through, and that's the Pfizer vaccine, the AstraZeneca vaccine. We must be ready, and I want to thank in advance GPs for all the work that I know that they're doing now and that there'll be even more of this winter to keep people safe. And on the clinical aspects, if I can hand over to JBT.
Yes, I mean, clearly the COVID vaccine programme, as soon as we have authorised vaccines and quantities at scale, is going to be the biggest and the most important thing the NHS has done for a very long while. And primary care are front and centre stage in all of the immunisation programmes that the NHS has ever delivered and will continue to be so. I do understand the workload pressures, but I do also think that it will be incumbent upon every one of us to put in extraordinary efforts to make this programme move as fast as we can, consistent with the available supplies and with the highest uptake we can possibly manage. This is a big opportunity to change the way the pandemic will roll out over 2021. It isn't going to produce an overnight result. It isn't going to affect the second wave that we're now in, but it could very dramatically change what the late spring and the summer start to look like. The precise bounds on that are unknown, but that's how big the prize is, and therefore it's really important that everyone pushes so hard on this. Not just the workforce, but also the public in terms of coming forwards for the vaccine, and as I said at the other press conference, being ready when you're called.
Thank you very much, JVT. I'll just say one more thing, because it's such an important subject, this. I know the pressures that the COVID vaccine rollout will put onto people across the NHS. It isn't just GPs, although GPs and the teams around primary care, the primary care nurses and the pharmacists will play an important role. It's right across the NHS. There will be work to do to get this vaccine rolled out. And I also know that there's a number of uncertainties which make planning harder, but it doesn't make planning impossible. And so it's critical that we get all that lined up so that we're ready to go from the start of December. And I want to thank in advance everybody who's involved in the NHS and more broadly in the rollout of the vaccine. It's going to be a big job. Thanks very much indeed to everybody. This ends the Downing Street Coronavirus Daily Briefing. Thank you.